Okay, welcome to the brunch. We are here with Black Girl Magic. Dr. Cindy Duke is coming up. So as soon as she gets on here, as soon as I see her, I'm going to bring her right on. Oh my gosh. Oh my gosh. Okay, let me see if I can find her here. Guys, do you have your cocktail or your juice ready? Because I have mine. Okay, now let me see. Can I find her? Because I want to introduce her with you guys here. Let me see here. Dr. Duke, are you here? If so, send me your request. Uh-oh, hold on. Not yet. Okay, hi you guys, happy Sunday. We're at the Black Girl Brunch. Okay, I think I have, here she comes. Here she comes. Okay, you guys, this is a renowned doctor that's coming in. We're waiting for her now. Hi!
Hello, happy Sunday.
Happy Sunday, Dr. Duke. Welcome. Thank you so much.
Hello.
Thank you so much for being here. You know, I have to tell you, my computer just froze. So let me see what I remember here. Dr. Cindy M. Duke, MD, PhD, trained in virology, gynecology, obstetrics, fertility specialist, the founder and medical leader and lab technician of the Nevada Fertility Clinic. All these things that are you. It's unreal, your resume. So Black girl to Black girl, you are truly magic. And we're
Thank you.
so excited to have you here. So can you tell us a little bit about yourself, where you grew up and all of those great things?
Okay, how's my lighting? It looks darker to me, but is it okay?
You look beautiful to me.
Okay, awesome.
You look beautiful
So,
to me.
yes, I'm everything that you've mentioned there, and I grew up in the Caribbean, so I'm from the Southern Caribbean, Trinidad and Tobago, actually from Tobago, the smaller island of the two.
Yeah.
I know a lot of people know Trinis, but they don't know a lot of Tobagonians. I'm one, and I have a brother who also most people know about from Tobago.
Oh, well, that's a little fun fact that we were going to mention with you guys. So who is your brother, Dr. Duke?
My brother is like you and your sister. He's an actor. His name is Winston Duke, and most people know him from either the Us movie or Black Panther. He was M'Baku.
Yes, yes. Oh, Winston Duke, we're a big fan. And you guys, and you grew up with a single mom, yes?
We did, we did. We call her Mama Coco, and yeah, we were raised by a single mother. She did an amazing job, managed her fertility, spaced her children, and here
Wow.
we are.
Wow. Well, she's already my idol because I might have to do this myself, and
Mm-hmm.
depending upon how life goes. Now, you and I have
Yes,
spoken before,
yes.
so you know that I have 29 eggs chilling in the freezer in El Segundo. And
Yes.
I did that when I was 37 years old. And
Mm-hmm.
so Dr. Duke, you guys, was not the fertility specialist that took the eggs out, but you might be the one to put one of
To
them
follow.
structures back in. Yes.
Yeah.
You guys heard that live, okay?
Yes.
But one of the things that is so beautifully interesting about you is you're a virologist. Am I pronouncing
Mhm.
that correct?
That's correct. Yes.
Okay, you're a virologist. And so that is the study of viruses and
Hmm.
how it affects the human immune
Immune system.
system, the immune system.
Yes. Hmm.
So you are on the front lines of COVID in the fertility space and in the viral space. So
Exactly.
yeah, can you tell us some things that we don't know? Can you dispel
Yeah.
some myths that are out there?
Well, it's one of those interesting, unique things that I got thrusted into because I am the only reproductive endocrinology infertility specialist, OB-GYN slash virologist. And I've seen lots of people who are like, whoa, is that even possible? But it is. And I didn't realize I was preparing for a day like this, a time like this rather. But yeah, COVID-19, you know, started by a virus known as SARS-CoV-2, which has taken the world by storm, literally.
Yeah.
And certainly here in the United States is not only impacting communities across the country, but specifically having pretty tremendous negative impacts in communities of color, including Black people and Native Americans.
Yes.
And we are amongst the hardest hit right now in this country. And what we know about the virus in terms of general health is it can affect every system in your body.
Okay.
And we're seeing that it's affecting people of all ages. You know, initially, much to my chagrin, unfortunately, the initial report said, oh, it's only in old people and those with underlying disorders, which, yes, they're at the highest risk, but they're not the only people who are at risk for infection. And so now we're seeing more younger people being impacted, even children, you know, and I think that's what's scary and scaring so many people is we're hearing more and more about children in the United States in particular. And I think it's because as a country, we took a different approach to this pandemic compared to other countries.
Mm-hmm.
And so unfortunately, we're paying a price that probably is a little bit steeper
Yes.
than we needed to pay. But when it comes to fertility and pregnancy, so far, it's overall safe for those who are healthy and healthy in pregnancy.
Okay.
She says, I'm going out and coming back in. Hold on, I see someone saying that. Are you hearing me okay, Kellee?
I hear you fine.
Okay. Maybe it's her connection.
Are you guys
then.
hearing Dr. Duke okay? Because that's who you need to hear today.
Okay. Micah Sweet says she can hear.
That's a yes.
Okay.
I'm getting some thumbs up. So
awesome.
We're good.
So what we know for pregnancy, so far it seems generally safe. We know some information about pregnancy and coronaviruses because there are other coronaviruses out there. So there's SARS, which we heard about in like 2003, 2004. There's MERS. And we know with those that while there seemed to be an increased rate of miscarriage in people who got infected, in general, people who continued their pregnancy did well. And that's what we're seeing so far. I mean, there are a few case reports of some questionable outcomes as it relates to moms who got infected. But when we really delve into it, these usually are women with underlying diseases like severe diabetes, preeclampsia or toxemia. But the truth is there's also a lot we don't know about pregnancy. You know, if we're being honest, this virus first came to our attention in December of 2019. That's 6 months ago. It takes 9 to 10 months to have a baby.
Right.
So we don't really have enough information yet about this virus and pregnancy. We haven't had a full gestation, so to speak.
Okay. So we're really still in the trial period.
We are.
Why protecting ourselves right now is so important because
very important.
You know, as much as we want to go outside and do those things, we just simply can't. So can you give us some tips, but can you also dispel some of the myths, you know?
Yes.
If there's things that you're hearing in the media that you're going, as a doctor and as a virologist, you're like, no, that ain't right. Can you let us know?
Yeah, I think the first thing is wear a mask when you go outside. That is literally one of the most important things that you can do for yourself and your family members if you have to go out. Physical distancing / social distancing is important, which is 6 feet apart, especially from strangers, people you don't know, people who don't live in your house, really is my rule. If they don't live in the house with you, you need to maintain a distance, no matter how much you love them and want to give them a hug.
Right.
The second is, you know, and I know people are stir crazy. We're having cabin fever. It's really annoying that we've had to change so much of our day-to-day lives because as Americans, we love our liberties.
Right.
We love our freedoms and our choices. But we have to keep in mind that the reason why we need to take all these precautions is there's no vaccine yet. No vaccine.
Okay.
There's no way to prevent yourself from getting infected if you're exposed. It's now up to fate what happens to you because there's no vaccine. But we also don't have a treatment. Contrary to what we're hearing in the news and hearing some very influential people at the top touting medications, there are no medicines right now that are effective in a consistent way. You know, we're hearing bits and pieces, but there's not enough in terms of data and information that proves anything is truly effective yet. It's not hydroxychloroquine, it's not remdesivir, it's not any of these. And people, we're not making this up. This isn't that we're hiding information from people. We don't have it. It's not there. Don't believe the hype, and don't expose yourself and your family because of a sound bite. Be careful. That's really important. And the virus is real. I know there are lots of conspiracy theories that circulated. I was one of those people who quickly jumped out to tell people, listen, Black people are not immune to this thing. Don't believe it. We're not immune. Don't listen to the stories that are saying, oh, Africa doesn't have it because Africans are immune. That's not true. The truth is, some countries in Africa have been affected. But the media, unfortunately, treats Africa like a lot of people, unfortunately, have treated Africa like it's one country. There are 50 plus countries in Africa.
In Africa, yes.
16 countries actually have a COVID crisis, okay? 16 have a crisis. The others don't, but it's because they're doing an amazing job. Right. So if you take, for example, Rwanda, you know, they're doing things that we still haven't done but need to do. So, for example, you know, in Rwanda, if you arrive in country, they're checking your temperature, they're screening you, they're putting you in, they're testing you early, they're putting you in quarantine if they have to.
And they're checking your temperature as soon as you come in.
Soon as you come in. They're even asking the airlines to check you before you board the flight to come to their country. We're not doing that. It's unfortunate. We're not doing it. Yes. We only instituted face masks as recently as last week. Before that, we weren't requiring people to wear face masks at the airport. You know, I flew 2 weeks ago and I was blown away by the number of people who were not wearing their masks. Wow. And so it's really important that we keep that in mind and don't fall victim to sound bites who are, you know, yes, Ghana did the same. No, most African countries actually have done amazingly well, but it's not because they're immune. It's because their governments actually took charge and did the things that they needed to do.
It's not because they're immune, it's because their governments actually took charge and the citizens were doing what they needed to do to protect themselves.
Yes.
So as much as you're tempted to fall into a soundbite or a conspiracy theory, take care of yourself, put those masks on, because correct me if I'm wrong, but the virus is transmitted through, if you're having it on your hands and you're putting it on your face, you're touching your mouth, you're touching your eyes. The mask isn't necessarily going to stop the transmission of the virus, but it stops you from touching your face. It's a constant reminder.
Hopefully.
Hopefully.
Because some people are touching their faces, they're putting on the mask incorrectly. So if you imagine this to be a mask, some people are wearing the mask like this, which is a problem because your nose is still exposed. You know, you're still breathing. I think a lot of there's this one video that made the rounds that really riled every virologist up, which is the Plandemic video, which is this woman who is a scientist that has been thoroughly discredited many times over the years. And she's now, you know, spreading these misinformation. But one of the misinformations that she said was, if you wear a mask, you're going to suffocate. You're going to get asphyxiated. So I'm here to tell everyone, as a surgeon and a doctor who wears masks for 8 to 9 hours per day, I'm still alive. I've never had a situation where I was like low on oxygen because I was wearing a mask. Now I wear 2 masks. 2. I'm wearing the N95 mask underneath and another one over. And guess what? I'm still here. Like Friday, I wore those masks for 10 hours and I live to talk about it.
Bringing babies into the world. And we're so grateful to you. We're grateful for all of this information, for being on the front lines, and for doing and for taking the time here today. So one of the things that you and I talked about, are you ready for roll call?
Yes, let's do roll call.
Okay, so we're going to do roll call. So everybody get your pen and your paper ready. And what we're going to do is I'm going to throw out some terms to Dr. Duke, who is going to briefly describe what that is, so that when we get into some more specific conversations. Everybody's coming from the same playbook. So we're just going to kind of like get a little information so that we
Yes.
can ask some questions. We know what we're talking about, right? Okay.
I'm excited.
I'm excited. Okay. Roll call. All right. So what are our ovaries and what are their primary function?
So ovaries, you're born with them. They are your reproductive organs, or what we call your gonads. Ovaries carry the next generation of your cells. Think of it that way. And so they house your eggs and the cells that take care of them. The really interesting thing is your ovaries are formed while you're still in the belly, in the womb. And so for a little girl, her eggs are formed when she's 20 weeks old. In the belly, then the eggs are formed. So your eggs are technically 4 months older than you, because all of the eggs that you'll ever have in your life, they're formed before you're born. You don't make new ones after you're born.
We're not men. We don't make sperm.
We don't make sperm. We don't keep making eggs.
That's all we got.
That's it. That's all you got.
A little older than us.
Yes, they're actually about 4 months older than you. So whatever age you are, add 4 months, those are your eggs.
Okay.
Those are your eggs. So it's important to know that. So your ovaries house your eggs, and once you're born, the numbers just start falling until they're all gone. Yes, Miss Lynn. Egg check. The moment you're born, when the baby girl is born, she has the most eggs she'll ever have in her lifetime.
Okay. Okay.
That's it. Yeah.
That's it, you guys.
It's all downhill from there.
Right. So that's our eggs. Can you tell us about our uterus and what its primary function is?
So the uterus is what we call the womb in everyday language, what we've read in the Bible and our books of worship and religion. That's the womb. It's your uterus. Now, the uterus is the place that houses a baby, and it's what nurtures the baby and grows it for the complete gestation, which is 40 weeks, which is 10 months. Okay. Now, the uterus, because it has to house a baby, every month it prepares, it anticipates that a baby may come when you're cycling. And so when you have your period, it's actually the completion of the last month's preparation for a possible baby coming in to implant. Okay. And so when you have a period, it's really the lining of the house. Imagine the carpeting shedding. It's the carpet shedding so that a new carpet can start growing in anticipation of another potential baby. And so that's what your womb is. Its primary function is to house a baby. And every month, like clockwork, as long as no one's interacting with it, and if you don't have things like PCOS, it's going to go ahead every month and start a signal that it gets from the brain to prepare for a possible baby coming in. So that's what the womb is for. The womb is not a sexual organ. And I know there's some people who are going to disagree with me, because so many women, even when their womb is working against them, refuse a hysterectomy because they're like, oh, I don't want to have sexual dysfunction. But the womb isn't connected in that way. You can still have amazing sexual function if it turned out your womb needed to be removed. Right. Anyway, that's a different conversation. Yes.
Right. Okay, that's wonderful to know. Can you tell us about our hormones, estrogen, testosterone, and progesterone? Can you tell us how they work for us?
Estrogen and progesterone are both made by the ovaries. Now, they're made by the ovaries. They're actually made by the cells taking care of your eggs. So your eggs do not make any hormones. They are there. They're living in houses, so to speak, that we call follicles. Yes. And so every egg house is lined with cells that formed back in the womb as well to help take care of the eggs. They're like egg sitters, right? Okay. Every egg is taken care of by an egg sitter, a series of egg sitters that make hormones in response to a message that comes from your brain, because our brain is our hormone center. The brain controls every message in our body. Yes.
Is that where the pituitary gland is
exactly.
located?
The pituitary gland. That is hormone headquarters in your body.
Hormone headquarters.
Yes, that's the hormone headquarters. The pituitary gland, as an endocrinologist and a biochemistry major from undergrad, I just love the science and chemistry of the body. This is what drew me in. And the pituitary gland is the ultimate chemistry headquarters of your body.
Okay.
It controls everything. It controls your mood, your sleep, your desire to wake up, your get up and go. When it talks to your thyroid, it talks to your adrenals, which are these glands that sit above your kidney that control your blood pressure, your heart rate, your desire to even just move a muscle. Your pituitary controls that. It controls how tall you grow.
Wow.
It does.
And
It does.
It's a pea-sized gland.
Pea-sized gland. It's just this
gland.
pea-sized gland, little, but we say in the Caribbean, it's little, but it's talala, meaning it's strong, it's powerful.
Okay, good.
Yes.
That is great to know.
Mm-hmm.
And another thing in our roll call, you know, I call myself a picky patient. And
Yes.
I am very WebMD. Okay?
Yes,
so
yes.
It's not always the right thing to do. But one time I was really, really tired. I was sad a lot.
Mm-hmm.
And I was gaining some weight. So WebMD told me that I
Thyroid.
had a thyroid problem. Okay, that's what WebMD told me.
Yes. I would worry about it too.
Yes, and I went into the doctor's office. I went to the endocrinologist, and I let him know. I know it's my thyroid. It's overactive or underactive, and they did the whole scan and
yes,
for me. And when I went back, he said, "My dear, nothing is wrong with your thyroid,
mm-hmm.
but here's a referral to a therapist because you might be depressed."
Yes,
yeah.
and it could be
now, but I was. That was
yes.
what the issue was. So, can you explain the thyroid gland
mm-hmm.
systems that are
yes.
connected with those?
Now, you actually weren't wrong, Kellee, because a lot of women actually have symptoms that overlap between depressive symptoms and thyroid symptoms, or anxiety symptoms and thyroid symptoms. And that's because the thyroid is an interesting gland. It's a butterfly-shaped gland that sits right in front of your trachea, in front of your windpipe.
Okay.
And it controls your body's get up and go. Okay. And so that's normally it's what makes you feel like getting out of bed in the morning. It's what gives you that motivation to actually complete things. It's what tells your muscles and your heart to move forward with any action in the end once it gets a signal. Now, the thyroid can be overactive or underactive. The more common one is underactive, and that's hypothyroid, which a lot of women have heard about. Hypothyroid means the thyroid isn't releasing its hormone enough, which is known as thyroxine. And usually that's when you have the symptoms you described. Your mood can change. You feel sort of flat, sort of just not with it, because it's your get up and go and you don't have it. So you lose your get up and go. You feel slow, you feel sluggish. If your metabolism isn't going well, because it controls your metabolism, so you won't burn fat as easily, so you gain weight. You might find that your periods start getting really long and heavy because, again, even the ovaries are confused by what's happening. Mm-hmm. And so hypothyroid patients have in the past, unfortunately, especially male hypothyroid patients, been diagnosed with depression without that being checked. So your doctor still did the right thing. You did the right thing.
I did.
They needed to check.
I got it first, and then it was when he ruled that out. Then he said
exactly, because it would have been a disservice to you to send you straight to a therapist without checking. If the therapist started you on antidepressants, but in fact you were hypothyroid, your antidepressant stuff wouldn't work very well. You still feel the same way, and you'd be getting sicker. So it's important that they figure that out. But the flip side is also dangerous. So that's when the thyroid works too much. And that's hyperthyroid. And the very opposite happens. Most people with hyperthyroid, they drop weight fast because the metabolism ramps up. So they lose weight fast, they get very thin, their heart starts racing because it's getting too much of a signal. They have palpitations. Many of them show up to a fertility clinic because their periods go away. Mm-hmm. Right? And they get anxious. So it's almost like a sense of doom. They feel panicky out of just for no reason. They suddenly get very panicky. And so
it's freezing up.
Freezing up.
Interrupt you, but are we freezing up, you guys? Somebody said we are.
Yeah.
Let's keep
It
talking.
might be their connection.
Yeah.
But yeah, so you can have anxiety, very opposite of depression there. Now this person just feels panicky all of the time, feeling like, oh my goodness, the world's going to end and they don't know why. And so it's important because that's another person who may get sent to a therapist for anxiety and
Right.
panic disorder. But if someone didn't check their thyroid, it ultimately could cost them their life because the heart would eventually give out from working so hard. So, yeah, so somebody saying, I was hyper, it felt like my heart was going to bust out of my chest.
Wow.
Yes, that's what it feels like. And so what you did was not wrong. And don't beat up on yourself for checking on WebMD. I prefer WebMD than just regular Dr. Google.
Oh, okay. Okay.
Yes, and
I play doctor, you know.
yeah, it's okay. It's okay. You know, I think, especially as women of color, sometimes we're not sure a doctor is going to do right by us because historically.
And historically, they do not. And this is something that has come up in a lot of talks. And then I want to get back to some of our terms.
Yes.
About advocating for our own health.
Yes.
Can you
Yes.
give us some tips? Because as patients that don't have the science, that don't have the medical knowledge, you sometimes can feel at a disadvantage, or you may ask a not so smart question, or you just are too shy.
You're shy. You're afraid.
Yeah. Is this the right doctor for me?
Yes.
Because, you know, could you give us some help with how to advocate for ourselves?
I would start with the last thing that you said, which is this the right doctor for me?
Okay.
And that's the literally most important question you have to ask yourself. So how do you determine if someone's the right doctor for you? Well, it should feel like they're approachable. You should feel like you can ask your doctor any question and they not insult you, not chase you out of their office. I, as a physician, I love it when my patients ask me questions. My patients laugh all the time because I never end a visit without saying, okay, so I know I did a lot of talking. Right. Is there anything that you wanted to make sure we covered today that I didn't bring up? Right? And I ask that question over and over, but I ask it open-endedly that way because I want my patient to feel like they can ask me anything. I never tell people that's a dumb question or no, because maybe you're asking a question coming from a place of less science, but your worry is real. Your concern is real. And so you shouldn't be dismissed. Yes.
Don't discount that. Yes.
Don't discount that. Yes. And so, you know, maybe you're not using the right word, but the doctor has been trained. They went to medical school. A doctor who paid attention in medical school was taught how to treat with a patient who's asking a question that's not exactly the exact wording that they're using. And so if your doctor is not patient enough to hear that, maybe they're not for you. Maybe this isn't the match for you. And I know for some people they say, well, Dr. Cindy, it's easy to say that because you have access to doctors. I only have one doctor in my community. If that's the case, then this is where advocacy comes in, right? This is where you say, you literally can say, doctor, I don't think you heard my question before. I'm going to repeat it for you. It is important to say that because maybe the doctor is busy that day. Not that that's an excuse, but if it were to happen, then your purpose is to advocate for yourself. If you don't feel like you can do that, then bring someone with you who can respectfully do that.
Okay.
You know, I know as people of color, we're afraid of getting kicked out of the office. We're afraid of people saying, don't come back, you know, because they just have such a low threshold for us standing up for ourselves. But at the same time, this is your health. This is your body. Nobody knows your body better than you. If you're a woman and you're like, my breasts don't feel right, it is not my job to tell you your breasts are fine. It is my job to investigate, to figure out what's going on with her breasts today and ask you the questions to understand why they feel different to you. But it's not my job to insult you and just tell you, you have breasts. Everybody has breasts. That happens sometimes. So that's not how that should work.
So this body of ours is our responsibility.
It is yours.
Right. And we shouldn't feel shamed into asking the questions that we need to ask. And if for some reason the communication between ourselves and the doctor is not working, it may not be the right doctor. And I love the point of bringing somebody with you if perhaps asking these questions or going through these conversations are sensitive to you, maybe you have a buddy that's a little bit
Yes,
more proactive in doing
exactly.
things. So I
Yeah,
love
it
that.
really helps. Some people also, you just freeze up, right? You walk into a doctor's office and your brain freezes. Like you're eloquent elsewhere. You can hold a conversation like nothing. But
Yeah.
somehow somebody walks into an office in a white coat and you're like, ooh,
Yep. Yeah, I don't
freeze.
yeah.
So I also encourage that you write them down. Write your
Right.
questions down. You can dictate it into your phone. And that way you can open it up and say, okay, I have questions. You don't have to remember it. You can just say, I have questions, doctor. And if your doctor says, I don't have time, you follow up by saying, can I schedule an appointment then to come back and talk about these questions,
To
right?
have an actual consultation about the things that are on your mind. Okay.
Absolutely. It's not enough for your doctor to tell you, well, we're out of time. If they're truly out of time, okay. If it's not an urgent question, the next step is, when can I schedule to come back? Because these questions are important to me,
Important.
and I need to hear your answers.
Perfect. Okay,
Mm-hmm.
so here's a story that goes along with our roll call, which is
Yes.
like we're just doing our thing. But a friend of mine had very bad periods. It turned out that she had fibroids, which I want you to talk about with us. And her fibroids were so bad and unattended for a long time that she actually passed what she felt was like a chicken cutlet.
Yes, that's a big clot.
Of tissue and blood while she was in the shower. She still
Yes.
got dressed and went to work that day and nearly bled out, was rushed to the hospital for a blood transfusion.
Yes.
That's extreme. That is something that fibroids did. So could you please tell us, what are fibroids? How are they treated? What do we do to have a quality of life if they're part of our journey?
You know, yes, that's an extreme story, but it's actually a pretty common story, especially in women of color. So women of color are 3 to 4 times more likely to have a story like you just described compared to non-women of color. And so fibroids, put simply, are overgrowths or benign tumors. So I know whenever people hear the word tumor, they shut down because they're like, oh no, cancer. But no, most tumors are not cancer, and this is one. It's a tumor, just like I said, the uterus, the womb, has to regenerate itself every month. It's an organ that's actively always preparing to house a potential baby. And so the muscle of the uterus, those cells are also constantly repairing themselves. And so they can start overgrowing into little balls known as fibroids.
Okay.
So that's what a fibroid is. It's a benign overgrowth, and some women can grow a lot of them. Black women in particular, 9 out of 10 of us would grow them. 9 out of 10 of us will grow them. Now, not every woman with a fibroid is going to have symptoms, but if you ultrasounded 9 out of 10 of us, you'll find at least one fibroid in us.
Really?
Now,
okay.
Yes.
Why are we more prone to that?
It's a number of factors. One is genetics, and we know this. It's not just African American women. You take Black women anywhere in the world, and they grow more fibroids, larger fibroids. So there's a genetic component to it. But the other is, we also realize now more and more, is they're less likely to get diagnosed early. So it takes 4 to 5 years for a woman of color to be told she has fibroids versus a non-woman of color being told somewhere around 2 years probably. And so during that 2-year difference, fibroids grow, and they grow in response to estrogen, which your ovaries are making. If you're in reproductive age and you're cycling every month, your body is cycling more estrogen from the brain message.
Helping to grow that fibroid.
It is. And
birth
so
control doing the same thing for women?
No, birth control actually helps.
Okay.
It actually helps.
Okay.
But many women stop their birth controls for a variety of reasons.
Yes.
There are a number of other factors. So there's some data that suggests maybe vitamin D plays a role, meaning vitamin D deficiency. However, we don't think it plays a major role, only because if you look in countries where people have high vitamin D, like warm temperatures, because vitamin D is a hormone. We call it a vitamin, but it's a hormone that's made under our skin if we're out in the sun.
Right.
Yes. And so if you look at tropical countries where people are actually out in the sun and have nice high vitamin D levels, they still have high fibroid rates. You look at Caribbean women who most of them are not vitamin D deficient, but they still grow big fibroids. So it's very clear that it's more than just vitamin D. And so what we tell people, it's multifactorial. Multiple things come together, but the bottom line remains the same. 9 out of 10 of us will have fibroids. The thing about fibroids is it's all about location, location, location. Where in the womb is it located?
Okay.
So to use one of my friends' analogy, Dr. Kiera, she says, think of the womb, the uterus, like a balloon. And so, you know, you have the inner part of the balloon, which is the cavity where a baby will grow.
Okay.
Then you have the wall, which is what actually keeps the uterus. That's where fibroids can be too. And then you have the outside that's touching your intestines and your bladder and stuff. Fibroids that grow out here, they can grow to be very big, but most people don't even realize they have them out here until their belly is grown very big. And that's because these fibroids don't do anything else other than just grow.
These out here. Okay.
And so those are known as subserosal fibroids.
Okay.
If you're told you have a subserosal fibroid, they don't really cause you immediate problems aside from, like I said, aesthetics. It can lead to constipation, indigestion, but it won't cause you bleeding. Okay. There are fibroids that are in the wall itself. They can cause your womb to get very heavy. It can cause you to have discomfort with intercourse. It can, you know, suddenly intercourse feels painful. But the most dangerous one when it comes to bleeding, what lands you in the hospital, is the one that's growing in the cavity. Okay. And those are known as submucosal fibroid, M-U-C-O-S-A-L, submucosal. And it's literally growing in the space that sheds every month with a period. Okay. It's the space where a baby needs to grow. And so these are the ones that can impact pregnancy. Someone asked, can they prevent pregnancy? Well, they can lead to prevention of pregnancy, they can lead to miscarriage, they can lead to preterm birth. And the reason why is because fibroids grow with pregnancy.
Because of the estrogen.
Exactly. And the time in your life that has the highest estrogen is when you're pregnant. And so think of the womb being an apartment, your baby being the tenant. As your tenant's growing, usually the apartment's supposed to accommodate the size of the tenant. But you also have the wall, which is the fibroid, growing. So it's actually restricting the space your tenant can grow in. Exactly. So it can lead to miscarriage. I can't tell you how many patients I've diagnosed that in. You fix their fibroid, they go on to have pregnancies and babies, no problem. They've had preterm birth or say, you know, stillbirth because of something like that. So it needs to be addressed. Someone says, child, I had 8 submucosal. That's a lot, and that's dangerous.
And to be honest, and I know she won't, you know, maybe not mind it, but that's the young lady that.
Yes. Because the submucosal, those are the ones that can literally, you can bleed out half of your body's blood supply in half a day. You can hose out real quick. So I like to tell patients this. If you're feeling lightheaded, dizzy with your period, that's not normal. And for a lot of Black women and women of color, we have periods like that and we assume, oh, that's just how periods work. Like I said, it's genetic, which means fibroids run in families. Okay. So for a lot of us, we don't even realize our periods are abnormal, heavy, because we go tell our mom, oh my God, you know, I keep having accidents, I'm lightheaded, dizzy. And mom, out of the goodness of her heart, says, that's our family. That's how it works.
Right.
But that's not true.
Normal.
It's not normal.
It's
so
not normal.
Yes, it's the family, but it's something genetic that needs to be addressed.
Yeah. So Coco Nerd Girl, who is on here, is my other friend, Lynn. She did get it addressed. That is who almost bled out and had the blood transfusions where I started to learn more about fibroids. So Lynn, we love you and continue to be proactive about your health. So let's, before I get some questions, if you guys have questions, you're going to go ahead and touch your question mark and write it down for the doctor. But let's do 2 more things if we can. If we can do endometriosis, what it is and how it's diagnosed. And if we can also do, you just wrote a wonderful article on PCOS.
Yes.
We can start with endometriosis.
Yes. So endometriosis is a classic pain syndrome that a lot of women have. We think up to 22% of women, that means 1 in 5 women, have pelvic pain, chronic pelvic pain. Endometriosis is interesting because it can take on a different picture in different women depending on what part of their reproductive system is impacted.
Okay.
Now, for a long time, if you look at disparities in healthcare and health research, women of color were less likely to get diagnosed with endometriosis when they presented to a healthcare provider complaining of pain and pelvic pain. Because unfortunately, it was more thought, oh, she's probably got an infection that's causing her pain. She's given antibiotics, told her she's got a presumptive chlamydia or gonorrhea infection, sent home. We now know, yes, you can have infections, but that's not the primary reason that most people show up with chronic pain. So endometriosis is a pain syndrome in particular, but over time, the pain syndrome, while that's a symptom, the actual things that are happening is it can damage your ovaries, it can kill your eggs faster than usual. It often requires women needing surgery and stuff to take care of things, but it's something that's really impactful on our society. So for example, endometriosis costs our society between 22 to 25 billion dollars a year.
Really?
Yes, and that's because of how many women need to take time off from work, how many women cannot function, quality of life is impacted. Exactly. In women, it's contributed to some of the opioid issues that we see today in the world, in the United States, because of that. And so
opiate addiction, some of that is about someone trying to quell the endometriosis.
Yes, and it's really affecting them. And endometriosis, for many people, it starts out in your teens, you know. So one of the things that I like to advocate for is if you have a daughter, a sister, a niece, who every month she can't go to school because of pain, if she's requiring a lot of pain medicine, this is probably the beginning of her endometriosis journey.
Okay, moms that are listening to this or future moms,
yes,
she has a lot of pain during her periods, she could be developing
endometriosis. Okay. And you know, if she's like around her period, she's having pain, she's vomiting, she's just in a lot of discomfort, you need to address it now. It's not going to get better for her. And again, endo we know now is genetic. 5 years ago, 10 years ago, we said there was no genetics to it.
Right.
And so again, what happens is a lot of families would say to their daughters, this is how periods are for us. If we're Christian, we go back to the book of Genesis and we tell our little girl, well, you're feeling pain because Eve made Adam eat the apple and God said we have to suffer.
Right.
I have heard that.
That pain every month, severe pain every month is normal.
It's normal. And that it comes from biblical time. Cramps are normal. Mom's cramps are normal. But yeah, if your daughter can't function, if she is stuck in a corner, just curled up in bed, they can't eat, they can't function, that's not normal. That is not normal. And so it's important to get to someone who can assess this. There are OBGYNs, there are pediatric gynecologists who can do it. Reproductive endocrinologists and infertility specialists like me technically are trained to do it. Some of us have decided that's not what we're going to continue doing. They just focus on the infertility. But I like to cover endometriosis, particularly in younger patients, because I know it's the #1 medical condition that leads to diminished ovarian reserve, meaning your eggs going away.
Egg count is going away.
Because endometriosis causes inflammation that kills eggs. It can scar fallopian tubes, and so the egg and sperm cannot meet, or the embryo gets stuck there for what we call ectopic pregnancies. It can lead to a lot of issues if we don't address it early. And so it's very important to get your child seen by not just a pediatrician, but if your child is having cyclical pain with periods every month, missing days from school. And I can't tell you how many adult women, when I start asking them their history, they say, oh my God, that was me. You know, and I'm talking to her at age 35, 40. And she's like, that was me as a teenager. And lastly, the reason why I like to advocate, so I'm glad you asked me about it, is it takes on average 8 to 9 years for someone to be diagnosed with endometriosis. Usually they're going from doctor to doctor to doctor seeking help. Many of them are sent to see psychiatrists and therapists because they're told it's in your head. Right. And she's like, I tell you, it's only a certain time of the month. Of course, for some, as time progresses, it becomes all of the month. It becomes painful intercourse. You know, I operated on a patient this Friday who I first operated on a year ago. And her husband said, can I just tell you something? For the first time in her life, last year was the first pain-free sex we've ever had in our marriage. And that was after we did her endometriosis surgery last year.
My goodness.
Yes.
My goodness.
Yes. So it actually impacts, like I said, it's $22 to $25 billion lost to society, but that's not even including what's happening in relationships, what's happening in the intimate.
We're not even enjoying intimacy.
No, she's just going through the motions because she wants to keep her partner happy.
Oh my goodness. And that's affecting our mental health. Okay. So
yes.
We have 15 minutes left, and I know that I do have a lot of questions here. So can we do PCOS quickly?
Yes.
And then go to the questions?
So PCOS, what I'll do is I'll direct people to that article that I wrote because it's really amazing. It debunks a lot of the things. But the big thing is PCOS affects up to 11% of women. You guys are probably like, so 9 out of 10 fibroids, 11% PCOS, 22% endo. Actually, that's true. And there are many women who can have all three. You can have all three. You can have endo and fibroids, polycystic ovary syndrome. It's a very misunderstood diagnosis because for a lot of people, they think that PCOS has to follow a specific picture, but it doesn't. Different women can have PCOS manifest in different ways. For some women, they have no periods during PCOS due to their PCOS.
So
for others,
very regular, or
you could have PCOS, but you can also have PCOS and have regular periods, right? So it's important that you see the right doctor because, you know, this article that I wrote is called Debunking PCOS Myths. And it's because the myths are the worst part of PCOS. It leads to patients not getting diagnosed. It leads to patients not seeking out diagnosis because they're told misinformation. Like one of the more common ones is women are told, if you're skinny, you can't have PCOS. You have to be overweight and fat. That's not true. You don't have to be obese to have PCOS. It's a myth. I have a lot of women in communities of color and international communities who are told, if you have PCOS, you'll never have children. And so PCOS is one of the most common stories where you hear these women talk about, I had a miracle baby. Doctors told me I couldn't do it, and I had a baby. I hear it. I roll my eyes a little, not at the patient or the mom who's saying that story, but I'm rolling my eyes because I'm like, man, somebody did her a disservice. Right? But at least she wanted that baby. So that's great. But there are lots of other young women who, because the doctor told them they'll never have children because of their PCOS, they don't use contraception. And so as a result, they're now pregnant with unwanted pregnancies and needing to seek out services to stop that pregnancy. And they're shocked. How did this happen? Well, it's because PCOS doesn't mean you can't get pregnant. And so it's really important that people understand that. And if you go read that
what I'm going to do is
article,
I'm going to put the link on my page, on the story, you guys. And, you know, well, Dr. Duke and I, we already know. We talked about it. I said, girl, we going to have to do a part 2. There's no way we can get all of this information in. We're going to, if you're game, Dr. Duke, we will do a part 2 for you guys. So I will definitely add your wonderful article because you're a published author and all those things so you guys can read more about PCOS. So what I'm going to do now, though, is go to the questions here.
Yes.
And see what we can bring up.
Sure.
Here we go. How does diet and food choice affect reproductive health?
They actually do affect your reproductive health in many ways. Unfortunately, a lot of our foods nowadays are processed and preserved, so they have a lot of additives that can act as hormones in your body. Some of them act as estrogen, but in a negative way in your body. And
Okay.
so it's very important to know what you eat. You know, we talked earlier about the body being a temple. As women, we need to keep that. This is Sunday. Let's remember that, you know, yes, you can go to a physical place of worship, but this, you only have it once. You are not going to get a new one. We don't have body replacements so far. So what you eat is literally what you live. So when you go to choose your food, be aware of what's in your food. If you're eating meat, you know, a lot of our animals nowadays that are farm raised are being chock full of hormones and antibiotics so that they don't get sick, so that they can sell them. But a lot of those antibiotics in animals work as hormones in our human bodies.
You guys hear that? A lot of those, they work as hormones in our human bodies. Okay.
Yes.
Okay.
So we need to be aware of that. Be aware of what you're eating. Be aware of the source of your food. You know, yes, you'll see lots of fertility specialists saying looking more for organic foods, looking more at farm raised, grass fed, and still being aware of what they're giving, antibiotic free meat. But if you're a meat eater, for sure. If you are someone who's eating animal products, but also plant-based products, you have to be aware that many soy-based products have estrogen-like activities over time. And so with your fibroids and all that stuff, you need to be mindful of that. You know, for a lot of women who have fibroids, endometriosis, PCOS, one of the first things I tell them is just watch what you eat. Start being more mindful of your ingredients, watching your dairy intake. Again, dairy, a lot of our cows that produce dairy milk, in order to keep them making milk, they either have to keep them pregnant or keep giving them hormones to make milk.
Okay.
Yeah. So keep that in mind.
Keep it in mind, you guys. All right, I'm going to go to the questions again, if it'll come up here. Okay. Here we go. Are there any long-term effects of the hormone injections used for egg freezing or IVF?
The short answer is no. And we've actually studied this because people will worry that maybe it increases your risk of ovarian cancer and different cancers. It does not. And so, yes, your doctor has to be judicious in screening you initially, making sure your mammograms are up to date. If you're over 40, making sure your pap smears are up to date. But that's more just preventative stuff. But it's not because the hormones themselves will give you a disease. We just want to make sure you don't already have something that a hormone may grow. So the short answer is no. If you're otherwise healthy and all of your screening's been done, there are no long-term effects to your IVF or egg freezing or fertility medications. And it's been studied and studied well over 20 years now.
Oh, good. And while we're on the egg freezing, one of the things you and I talked about on the phone is about the financing of egg freezing.
Yes.
And
now,
can you speak to that as a doctor and with and what ways we can finance this?
I like that you bring that because especially when it comes to egg freezing, you know, we're trying to encourage people to freeze eggs when they're in their 20s and 30s. But for a lot of us, especially the typical egg freeze candidate is someone who's probably either not married, or if they're married, they're definitely not ready to start a family.
Right.
And so finance-wise, they're also probably thinking financially, I'm not in that place. And so a lot of people, even though they're interested, don't access the service because they're afraid it's too expensive and they won't be able to afford it. The first thing to know is it's actually way more affordable than you think. But let's say it's still costly, then there are lots of ways to afford your egg freezing. And so for some people, it depends on where you work. There are a lot more employers nowadays that have full fertility benefits. That's how they're recruiting women. So Facebook, Google, Amazon, Tesla, Starbucks, they all have benefits.
They're recruiting women to work for them because they have this benefit.
They have this benefit, and it covers all of that, including the medications. There's 16 states in the United States that mandate fertility benefits. So if you have an employer, they have to cover. The newest state to join that list is New York State. New York is now a mandated state.
mandate infertility coverage.
And so this is
Guys.
huge. This is big to know. If you're living in New York, this became law as of January 1st. It's law in New York State. You need to know this. Go check out. Right now, maybe you don't have a policy that covers it, but what you need to do is call your HR specialist and say, which policy do we have that covers those benefits? Maybe you pay an extra.
You need to call
your human resources specialist where you work if you have a job, and meaning if you're not self-employed, because if you're self-employed, it's different. But if you are employed by a company, etc., that's what you do. But here's the other kicker. Let's say you don't live in one of those 16 states, but you work for a company that's headquartered in one of those states. The mandate covers them because they're headquartered there.
Do you guys see why I have Dr. I mean, I never even knew that. So there's 16 states, and if they're headquartered in that state, then they are mandated to cover it. So we got to work on getting the other states to get mandated.
We do. And actually last week,
part of my mission too.
There's a big part that we need to play here.
Okay, we're going to work on that.
Yes.
And then if you are self-employed or if you don't work in a mandate state, what do you suggest?
The other thing I want to tell people, especially women of color, is you can gift egg freezing, right? So maybe you're younger and you don't quite have the finances, but childbearing is important to you. Maybe grandma keeps asking you, when are you going to have kids? Did you find somebody yet? You know, my mom's joke used to always be, whenever I started a new residency or internship, like, you didn't see anybody there that was cute? No, Mom, I went to work. I wasn't looking. And so if they're constantly asking you these, maybe one of the questions that you need to ask is, can you guys help me pay for my egg freezing? And you can gift it. There are many people who are out of other cultures, other communities, where they pay for their daughters, their nieces' egg freezing because they know gifting is a thing, you know. Now, the other thing is, though, I'll be honest with you, many of us can afford egg freezing if it were just a priority in our minds.
Now, Dr. Duke, and I'm going to speak on that because it was a priority in mine. And what I did is, you know, the credit card applications that come in the mail, I filled every single one of them out.
Yes.
Someone gave me the biggest limit. I said check, and I put the whole egg freeze on that. And as I told you earlier on the phone, one of the things I also suggest to ladies and men and whatever the situation is how we spend thousands of dollars for baby showers for our friends and loved ones. We do. And, you know, wedding gifts. Throw yourself an egg shower.
Throw yourself an egg shower.
Register at PayPal.com. Like,
exactly.
Because the people that love you will support you.
I'm telling you, if you have 50 friends who give you $100, you're there. You have your egg freezing cycle mostly covered. So it's important for us to know this and have that conversation. We need to have this conversation every day. Let's break the taboo. We need to have this conversation at church, at the baby showers. Yes, it's great to congratulate the person having the baby, but let's also talk about it. Many of us spend on amazing vacations. I'm a girl who loves to travel, and I treat myself. But, you know, if you take 3 vacations a year, one vacation, just say, you know what, this year I'm going to take 2 instead of 3. That's your egg freeze. There are lots of ways to do this. We just need to first start telling ourselves, one, I don't make eggs for the rest of my life. Black may not crack, but the eggs go away. We need to know.
I love that quote. That's going to be the quote for this. Black may not crack, but the eggs go away.
They go away.
Now, we are going to count down, Dr. Duke, because 2 minutes left, you guys. So, and I know Rochelle had a question. I saw her here.
I did see it.
It was something that started with an A. I actually don't know it, but what I'll do is I'll research it for part 2. So I am going to formally ask you live, Dr. Duke.
Yes.
Do a part 2 with us.
Absolutely.
And what I can do is have more of these questions, you guys. If we didn't get to your question, it's just because of timing. So send them over to my DM. And what we'll do is I'll curate it that we really go through these questions. That where part 1 wasn't actually seen. And we will do a part too. So
Absolutely.
she said absolutely, y'all. She said cheers,
Absolutely.
Dr. Duke.
I love it.
I am raising our blood
Cheers.
pressure. Cheers, cheers. I want to say thank you. From one woman to another, it gets me a little emotional because I never thought that freezing my eggs
Yes.
would lead me here.
It's a journey.
I'm
It's truly a
glad.
journey, and it's a self-discovery.
It really is. I'm glad that I haven't found the man yet, and I don't have the baby yet. Because if I did, I wouldn't be speaking from the heart.
Yes, and you
I
wouldn't be ministering, because this is a ministry now. This is a ministry.
I wouldn't have this story to tell.
Yes.
So people say to me, well, when are you going to get married? When he does it. But what I know now is that since it hasn't happened yet, this is my purpose, to keep having these conversations.
Yes.
Meeting women like you that will help me have these conversations.
Agreed.
So I salute you. I thank you. Can everybody please put up some applause and some hearts to Dr. Duke?
Thank you, everybody.
I'm going to save this and I will call you. We'll schedule the next one. Okay?
Absolutely. I'm ready.
Thank you. And be careful out there on the front lines. And
Thank you. Bye,
you.
everybody. Happy Sunday. Cheers.
Right. Cheers. Take care. Mwah. Bye, guys.